the process of planning out what your teaching strategies are going to be in the classroom. We want to create these innovative, creative learning experiences for our students so that, first of all, they can stay awake. And then, second of all, we want to engage them in a way that allows them to comprehend sometimes complex concepts in a way that they are able to make safe patient care decisions in the clinical setting. We are excited to continue to explore those 12 biggest, we like to call them opportunities, also known as mistakes, that we want to avoid when it comes to engaging in these evidence-based practices. All right, so first and foremost, you all know what our steps are when you join our Snapshot. We want you to pull out the study worksheet. You're going to write down today's date, whatever date you're watching this snapshot. The second resource we want you to pull out is Billings and Halstead. Now, we're still in the 6th edition, because this is the one that is aligned with the current C&E exam as of 2025. We want you to focus on chapter 16. Specifically, we're going to go through page 297 looking at case studies. Okay, so what are the benefits of case studies? They represent an in-depth analysis of a real-life situation as a way to illustrate class content. The second part we want to point out is under teaching tips. So that first paragraph says a well-designed case that illustrates the most important learning outcomes is critical to the success of learning with this method. As we look at case studies and the other 12 or so engaging learning strategies or teaching strategies, this is what we want you to think about. First of all, am I integrating any of these teaching strategies into my everyday work? The second question we want you to ask yourself is why not? Okay, so we're going to go deeper in looking at one of the critical opportunities that's associated with our work. I know this is not going to be a surprise for most of you, and that is trying to be perfect. Okay, so that's mistake number 8. The mistake is that when we strive for perfection, we create unrealistic expectations of ourselves, and that leads to a lot of overwhelm, often a lot of stress and burnout. The solution: acknowledge our mistakes because we're human, create a sense of resiliency and adaptability so we can move forward. And that's what we're talking about in the snapshot. Benjamin Franklin says an investment in knowledge always pays the best interest. This is aligned with Malcolm Knowles' adult learning theory. His work says we are to be committed to lifelong learning. Our ability to have a self-awareness of where our knowledge gaps are is step number 1 on the journey in helping us become a better nurse educator, a better nurse, and ultimately to achieve certification on the certification exam, whether that's C&E, CHESI, or any other exam that you're on your journey to be successful on. The second step we want to take is looking at our thought-provoking question. Okay, so you all know that's part of our strategy is we want to engage in a way that is going to help you close your knowledge gaps, have an increased awareness of exactly where those knowledge gaps are. And then third of all, we want to be your partner as we explore what best steps you should take to close your knowledge gaps. 70% roughly was the success or the passing score, the passing rate for nurse educator colleagues taking the C&E exam. Now, this is based on a statistic that was published by NLN in 2024. So only 70% of nurse educators who took the exam passed the exam. That's a low pass rate. Our goal is to help improve that. Mistake number 8, we talked about. You're going to be able to hopefully assess where you are today as it relates to your alignment with this mistake, and ultimately identify exactly what are your next steps going to be to help decrease overwhelm that's associated with this particular strategy. And this is the resource that's going to help you. So if you go to drsellerseducate.com/educator mistakes, that is where you will find the ebook that is going to identify and unfold each of these mistakes as we walk through them together. Our thought-provoking question: we have Professor Sam, who dedicates excessive hours fine-tuning lecture slides, avoiding the adoption of innovative teaching methods due to a fear of failure. How many of us can relate to that? I know if I could see your hands, there are some raised right now. So here's the question: how can Professor Sam effectively manage the emotional challenges of change and also enhance teaching through the lens of affective learning domain? So before we even get to the three options, this is what we want you to consider. Okay, this is called a thought-provoking question for a reason. Number one, what is it that I know for sure about concepts that are listed in this thought-provoking question? And then number two, what is it that I can eliminate? Okay, or what is it that I can, when we look at the options, decipher from what I know about this question and what this question is asking me. Okay, so what is this question really asking me? What do I know for sure? And how can I eliminate options as we unfold them and review each of them together? Okay, and then what you want to do is write down the correct option on your study worksheet. So we have A, develop a peer support network to share experiences, learn from others, and build confidence in adopting new teaching methods. B, gradually integrate new strategies while reflecting on emotional responses to change, fostering self-efficacy and emotional resilience. Or C, set specific measurable goals for introducing new methods using emotional milestones as indicators of growth and readiness. So I'll give you a few seconds to read over the question. Think about what the question is asking you. Think about what you know for sure about concepts related to this question, and then start to eliminate one of the options and hopefully get down to the best option. All right, now we'll go ahead and dispel the myth that this is a question that has really good options. Okay, it has really good options similar to NCLEX and the questions you can expect to see on the CNE exam. Now, I know with the NCLEX, there are lots of different types of questions now with NextGen, but similar to the CNE exam, you may very well get to a question and you think, oh my goodness, there are two right answers, but there's only one best answer. Okay, so you want to go ahead and get in the practice of figuring out how do you determine what the best option is, knowing that there are two really good options. Okay, so now we're going to go back to our content, and then we will wrap up our time together by taking a look at exactly what that best answer is, as well as the rationale. We call our questions thought-provoking questions for a reason. We want to engage in a deeper thought, a deeper understanding of the concepts as we talk to them together. That's what this snapshot is all about. How do I embrace imperfection and find that strength in vulnerability? We know that it can be tough in education for us to be able to get to a point where we are using our time most effectively, because we do want to make sure that the information we're giving our students is accurate. Okay, so that's a critical step. But the burden of perfection is what we want to shift away from, right? We want to create a learning plan, a teaching plan that we feel good about, knowing that we have done our due diligence to validate that the information is accurate. So here's a question. How can embracing vulnerability act as an educator, enhance student connections and learning? It's okay to be human. So this is what we want you to reflect on. How can embracing vulnerability as an educator enhance student connections and learning? We take a look at Billings and Halstead. The entire chapter 3 is all about how can we effectively create teaching and learning experiences for our students in a way that supports the inclusive learning environment that allows learning to actually happen. All right, so this is just a self-reflective moment, right? There's no wrong or right answer. And why is it that we should embrace imperfection? Why are we having this discussion during our time today? Well, first of all, there are consequences associated with perfection. Not only can it create a large amount of emotional distress, but it also can lead to a lot of wasted time, right? We can tweak our content, we can tweak our engaging activities, but ultimately, until we've executed and really experimented with that innovative learning strategy, we don't know if it's going to be effective or not. Okay. And then the other rationale or the other connection with the negative associated with trying to be perfect is the unrealistic goals that we create for ourselves. We want to be able to balance those, right? We want to align our goals with the priority of the nursing program or with the specific curriculum that we're working on. So we got to make sure that we set those realistic expectations for ourselves. When it comes to progress, that is our goal. We want to get better. We want to engage in Malcolm Knowles' adult learning theory concepts. as it relates to self-actualization, to identify what are my opportunities to improve as a nurse educator and what are my steps going to be. Not that I'm looking for perfection, but I'm looking for progress. And I want to be able to do that in an authentic type of way. Well, what do we mean by that? Well, first of all, having a self-awareness of where my knowledge gaps are and what I need to work on is a key step in our developmental process. Okay, so that requires a special, unique type of honesty and self-awareness in order for me to move forward on my journey. I have to be able to, first of all, identify where are my gaps, and second of all, how am I going to improve? How am I going to close those knowledge gaps? And then the other part of authenticity is identifying who's going to help me close those knowledge gaps. How am I going to show up better for my students so they have a richer learning experience and I have more satisfaction in the job that I'm doing every day? And then third of all, that mindset, okay, which aligns with me feeling good about the job that I'm doing every day. The ability of for you to be able to identify, okay, what are those mindset challenges? What are those blocks that are getting in the way that will not allow me to push through this whole thought about being perfect in the classroom, about the thought of being perfect in the clinical experiences that I'm hoping to align my specific students with for that day, right? We know in clinicals, we can make the best plans, but sometimes it doesn't work out. So, how can I overcome now that we've talked about what some of those imperfection ideas and thoughts really lead to, whether it's stress, me not being able to meet my goals, me having mindset blocks that prevent me from doing a really good job, right? So, how can I overcome all of that? First is to give yourself some compassion. Okay, so show yourself some grace. Being kind to others as well as to yourself is a key characteristic for all nurse educators, and we want to practice and role model that for our students. And then, second of all, thinking about how we can serve others. Mentorship helps us grow and succeed. So sometimes we do need to be the mentor, absolutely, to our students, to our colleagues. And sometimes we need to be the mentee as well, right? We need to receive feedback, advice, support, direction from our colleagues in order to help us get over some of these tendencies that we may be struggling with. Some of the common mistakes associated with the thought of being perfect and not wanting to make mistakes is over preparation, right? Wasting too much time on developing content that we just need to get a good idea about how we're going to align the content with the actual learning objectives and learning outcomes and execute. Second of all, is neglecting student feedback. That's a big mistake. It can be painful sometimes to look at that student feedback, but there's valuable insights there. And we want to be able to pick that out in a way that's going to be constructive in helping us move forward to create better learning experiences for our students. Trusting the feedback that we get and creating and really transforming those into learning opportunities. That's exactly what they are. Every data point, every feedback component that we get from our students, from our colleagues, is just helping us be better. Okay, so we want to avoid making those mistakes, but be very transparent and open about opportunities for improvement. And then fourth, our last mistake is really focusing on that perfection because it leads to unrealistic expectations, not only for ourselves, but also for students. So just being, again, honest with our students about expectations from day one with the syllabus, talking to students about any muddy points, any unclear directions that we may have given. We want there to be clarity and clear communication associated with what we expect from our students. And now we're going to transition and looking at what the best option is. So hopefully you've had a chance to write down the correct option that you have chosen. This is how you can reach us. Our website gives you a lot of great resources that can help you move forward on your journey. And you can also email us if you have any questions at any time about content or about a program. Maybe you're not finding a program that you think would be helpful for you. Just email us and let us know. We're happy to help guide you as you look forward to how to improve, and we want to be a partner with you to be able to make that happen. All right, so hopefully everybody is ready now. Let's talk about the best option. All right, so if you chose B, give yourself a round of applause. So gradually integrate new strategies while reflecting on emotional responses to change, fostering self-efficacy and emotional resilience. Now, why is this answer correct? Well, first of all, let's talk about the other two options, why they are not correct. All right, so they were really good options, okay? But the reason why, or I should say, and the reason why they were not correct, the best option is they only focus on vulnerability and emotional challenges or milestones. They're missing the really important part, which is about the teaching strategy. So when you look at the question, it was how can Professor Sam effectively manage, right? So managing these emotional challenges and change associated with teaching from an affective learning theory says we have to execute, right? We have to face our fears. And I know for many of us that can be challenging, and it may be difficult the first time we engage in a new teaching strategy, but you know what? It gets a little easier every single time. When it comes to Prezi, you all know if you've been live for any of my sessions, any of our workshops, you know, from time to time we have technical difficulties too, right? That's that vulnerability, right? That's that human element coming through. Students know that we're human, and it's important for us to do our due diligence on the front end to get the training we need. But ultimately, we've got to try these innovative teaching strategies. I know many colleagues are engaged in escape rooms. That's a wonderful way to get students more actively involved in the learning process. So going back to A, again, that focused on developing that peer network and learning from others. And C, focused on those specific measurable goals for introducing new methods, which is great, but we're missing that teaching aspect, which B so specifically talks about. Okay, so it talks about integrating new strategies while also reflecting. We want to do both. We want to be able to engage in those new strategies, and we also want to reflect on what we could do differently. Speaking of reflection, now we want you to take just last 10 seconds. Okay, so just stay with us 10 more seconds. We want you to take time to pause and reflect on what attracted you to the incorrect option and why did you choose the incorrect option? Our last step when we think about reflection, going back to Tanner's clinical judgment model, is we want to consider what are we going to do differently next time, okay, based on that thought-provoking question. We'll give you a few seconds to think about that. We're going to play some soft music as we transition out of this snapshot, and we look forward to seeing you in the next one. Have a great one, everybody.